Hey guys, so if you are new or you may not know, I am a registered dental hygienist. So today I'm going to be sharing some of my tips for any new dental hygienists that are graduating. So first and foremost, real life and school is 100% different. So I promise you that if you're going into the workforce thinking that it's going to be just like school, it is so different. So what you've learned in school is 100% different than what you're going to learn in private practice. What you learn in private practice is just something that you're never going to be able to learn from school. Anytime that you go into a new office, make sure that you take time to play with everything. There's nothing worse than bringing back a patient and not being able to figure out how the heck to use the chair, or bringing the patient back in the chair and then figuring out that your chair is way too high or too low, and then trying to figure out how to adjust your chair. So something that I've learned the hard way is to play with everything. So not only play with the chair, play with the software, play with how to take the radiographs, play with all the drawers, figure out what's in every single drawer, where everything is that you need, any backups, like where's the storage, where can you go get more toothpaste if you need it. Figure out all of that stuff. Figure out how the sterilization process works, because you don't want to be finished with the patient and then not knowing what you're supposed to do next. If for some reason you are unable to go in a little bit earlier that day to kind of check everything out before your new patient, something that I personally always do is ask if I can go in on a different day beforehand and just kind of scope everything out, even if it's just for 5-10 minutes, just so that I feel more comfortable going in there and knowing where everything is and what I'm doing. Because if you're only able to go in there like 10-15 minutes before the first patient arrives, that's really not enough time to look through your charts and also look around and see where everything is. Always make sure that you figure out how the flow of things go. So figure out exactly what is expected of you, because every single office is going to be very, very different. So some offices that I've worked in, like I mentioned in a previous video, want you to do nothing but hygiene back to back to back to back all day long, and that's it. Other offices want you to be more involved in teamwork, and if you have any downtime or you're running ahead, they want you to help other members of the team and help the assistant with sterilization or help the girls up front. So figure out what exactly they want you to do. My favorite thing in hygiene school was patient education. I was like a freaking Nazi with it. I have so many documents that I have typed up of like just different patient education materials that I would like hand out to my patients. And I loved being able to have like that 10-15 minutes of the appointment in hygiene school to be able to go over everything oral hygiene related with them. But in the real world, you're not going to have that. If you're spending 10-15 minutes of your appointment, you're going to be behind. You're not going to have enough time to do everything unless for some reason they give you a lot of time in your appointments. So one suggestion that I would give to you is to do your oral hygiene instruction while you are working on the patient. So whenever I'm scaling, I always go over the inflammation calculus, how that stuff forms, the systemic relation to the body overall. And then whenever I'm flossing, I also go over like flossing instruction and other alternatives that they can do for flossing. So do that while you are also doing your cleanings. Always pay attention to the clock. Our job is extremely time management oriented, and you're always going to be pressured for time. So always be aware of exactly what time your next patient is coming and what time the one after that is coming, so that you can have a little mental note in your head that when you take a second to peek at the clock to see how you're doing on time, that you know exactly what time to look for so that you're finished in time for your next patient. That is something that I always do. I used to do that so much more when I first started because it was harder to kind of figure out exactly how much time I would need to spend with each patient without actually physically watching the clock the whole time. But now I'm able to kind of like feel in my head when I'm spending too much time with the patient or when I have a lot more time to go. Whenever you first sit down your patient and you go to start the cleaning, do a quick overview first. Take a look at everything in the mouth, see exactly what areas look like they're going to be the worst. I typically almost always start on the lower anteriors just because they typically tend to be the worst. So that way I can get the majority of the work out of the way ahead of time, so that way I have more time to spread to all the other areas in the mouth. If you don't write it down, it didn't happen. Remember, you are a licensed professional, so if you are saying that you provided a service, you need to make sure that you wrote it down, that you actually provided that service. So you have a legal liability next to your name, so make sure that you are documenting everything. If anything in the appointment happens, make sure you document it. If for some reason a patient refuses something, make sure you document it. Make sure also that you get your own malpractice liability insurance. Even though we are covered underneath the doctor's insurance, that doesn't mean that if worse comes to worse, the doctor's insurance could turn around and sue you. So make sure that you have your own insurance to cover yourself. The insurance I have is really cheap. It's like $68 a year, so trust me, it is worth it. You hope that you never have to use it, but it is there if you need it. Get familiar with the insurance. So I still don't know a whole lot about insurance, but I do know enough so that I am able to help maximize what my patients are able to get out of their insurance so that they're getting the most benefit that they can, and also to help prevent them from getting any nice surprises in the mail of something that we thought was going to be covered but actually is not. Pay close attention to your doctor's recommendations and verbiage. So like I had mentioned, the doctors are very, very busy. They see like 3, 4, 5 times the amount of patients that you do in a single day. So they don't have time to spend all the time that you do with your own patients. So pay attention to what kind of treatments they recommend for certain situations so that you're able to do the same and go over that with the patient so that your doctor doesn't have to spend 10 minutes explaining it to them. Pay attention to how they describe things and what kind of verbiage that they use, again, so that you're able to pre-do that with a patient so that when the doctor comes in, they already know that that's been discussed and they can just kind of reiterate whatever you had said to them previously. I promise you that your doctor is really going to appreciate that. Explain each process to patients, especially the nervous patients. So the majority of patients, as you know, that come to see us are not that excited about being there. A lot of people do not like coming to the dentist. So one thing that I've personally found to kind of help ease the situation is to be as open as I can be with them. So explain everything that I'm doing. When I'm probing, explain what you're doing, explain why you're doing it. When you're polishing, explain why you're doing it, explain what you're doing. And especially for new patients and like children, make sure that you show them everything beforehand and kind of have different ways to describe it so that it's something that they're able to relate it to. So that way it's not something that's super scary. Whenever you put it in their mouth, they're kind of aware of what it already is and what it does. People want to know what you're doing. You're in their personal space, in their mouth. So the more knowledge that they have on what you are doing, the better they're going to feel and the more comfortable that they're going to feel with you. Going off of what I just mentioned, feel every single patient out. Some patients love going and just getting out and having someone to talk to. So if that's the kind of person that you have in your chair, then feel more open to be more talkative with them. On the other hand, if someone is having a bad day or they're really just not in the mood to talk, then don't try to force conversations with them. Kind of go off of what they kind of give you. So if I'm trying to talk to a patient and I'm getting really short answers, I kind of take that as a signal as, okay, this patient just kind of wants to get in and out, so I'm going to do what they would like me to do and do that for them. And don't take it personal. Some people just aren't happy to be there and they're just having a bad day. Otherwise, it's really, really nice to talk to your patients, but remember, the more you talk to them, the more they're going to reply. So be very wary of that whenever you are worried about like time. Don't settle for an office that you are not 100% comfortable with. So of course nothing is going to be perfect, but I can tell you there is better. So don't just go for the first job that you find. Find an office that has the same morals and values as you. You do not want to be working for someone who doesn't value your opinion. You want to be working for someone who trusts you and values your opinion, your professional opinion, as a licensed healthcare provider. You want someone who is able to back you up. If you're working with someone who does not back you up and does not value your opinion, that is not a good office to work at, and I promise you, you are going to end up wanting to leave. In addition to that, make sure that you are at an office that has really good teamwork. You spend so much of your time at work, regardless if it's in hygiene or not, You spend so much of your life and your time at work, and life is too short to be miserable and to hate going to work every single day. So make sure that the people that you are working alongside have really good teamwork and are there for you. Because at the end of the day, we're all there for a common goal to help our patients get whatever they need finished. So if you have downtime, if someone else has downtime, it's really nice to work in an office where everyone is able to help each other and it's not just everyone for themselves. Keep extras close. I can't tell you how many times I'll be working on a patient, not paying attention to what I'm doing, put the mirror down, tap it with something, and have it flip off the tray. It is so frustrating when you're running behind, your mirror falls on the floor, you have to get up and you have to go out and grab a new one. Make sure that you always have extra stuff stocked in your room so that way you're able to just grab it and keep going. So I do that with mirrors, with floss, with prophy paste. It's so frustrating when you're polishing someone and the prophy paste falls on the floor. You're in the middle of polishing them, there's prophy paste all over their mouth. So please just keep extras there, and I promise that you will be so happy that you did. I can't tell you how many times that we've set up trays and that maybe you forgot to put a prophy angle on it or you forgot to put floss on it. And again, you have to go up and grab more stuff because it wasn't on your tray. Same thing with people who have bridge work or braces. Keep super floss, keep bridge aids handy so that you're able to have that and just continue to keep going. If there are other hygienists in the office, observe what they do and ask them questions. So they are going to know what's expected of you guys in the office. They're going to know the flow of things. So they are the best people to go to ask questions to, because they've been there and they know. No one relates to you more than the other hygienists in your office. Go through your charts before you see your patients. This is something that I do every single day. As soon as I get there in the morning, I go through all of my patients' charts. If I have time to do the whole day, I will. If not, I will do the morning first, and then before lunchtime, I will go through my afternoon patients. It's really nice to know ahead of time exactly what your patients need, so that way when I have my printed out schedule, I can write exactly what each patient needs. And I can write if they need to be pre-medicated, if they need to have nitrile, if I need to have a threader out because they have a bridge. It's really, really nice to have all those little notes out, so that way whenever you're, in your kind of groove of seeing patients, you can just look at your schedule and see, okay, well, I need to get this and this and this out for this patient. This patient prefers this kind of prophy paste. This patient prefers this. It's really nice to have that already done for you. In addition to that, it is really nice to make personal notes about your patients. Patients love that you remember things about them. They love that you actually were listening to what they were saying. So something that I always do is if our patient has children or they have something exciting going on in their life, or they have vacation coming up, I always write it down. I write down what grade they're in, what kind of things they're interested in, so that I can ask about it next time. Because even though there's certain patients that you remember, there's going to be so many more that you don't. And you're going to feel so bad when you see them because you know that there are things about them that you talked about, but you don't remember what it was. You see so many patients in a single day, so unless you're writing things down to remember about them, you're probably not going to remember it. And I promise you that when you bring those things up, they are really, really going to appreciate it. Trust yourself. So it is very nerve-wracking when you first start out in hygiene. Any new job is nerve-wracking, but it's also nerve-wracking when you go to an established office and a patient is seeing the new hygienist and they're not seeing the person that they saw before and they get upset about it. It's a very tough position to be in, but just remember that you know your job. You have the skills, you have the education, you can do this. At the end of the day, all you can be is yourself, and that's enough. So be yourself, try to be as personable as you can, but also remember that not every single person is going to like you. Don't take it personal. You are not going to please everyone, and that's okay. I would say that 99% of the patients that I've seen love me and they think that I am super gentle and I'm very thorough and I'm very educational, and then every once in a while you will get someone who tells you that you were very rough or they're unhappy with something, and for that moment it really puts a dagger in you because you're like, really? Like, I work really hard and I've never have people tell me that. But just remember, people have different personalities. Not everyone is going to vibe together, and that's okay. At the end of the day, all you have to do is your job, and you know that you care about your patients. At the end of the day, we are all human. You're gonna make mistakes. You're going to do things that maybe you wish you would have done differently, and that's okay. That's how you learn. No one is perfect. I've made plenty of dumb little mistakes. When I first started working for actually my current doctor, I was super nervous to be around a new doctor, and he had asked me for some paper, and I wanted to hand him a sticky note, not thinking that obviously he meant articulating paper. So I know you guys know what that is like, and I promise it's gonna happen a million times, but it is okay. Trust me, you'll be fine. Thank you guys so much for watching. If you want more videos like this or certain ones, please let me know down below so that I can make them for you. As always, don't forget to like, comment, and subscribe. Thank you guys. See you next time.